few months back we had a press meet saying that we had done more than 300 cases of robotic knee surgeries, and now again we are in the press to present one more thing. So this is slightly different from what we have done in the past. So this is very interesting case, because the moment the patient came to the OPD, I was under shock seeing the patient. Where we asked the patient to sit, he is standing beside the chair of the chair height. So I slightly got confused what to do with him. So his initial complaints were knee pain, but the knee pain is going for many years. And the more interesting, so initially we thought he would settle down with simple pain medication. He's taking this medication for last 5-6 years, and he is doing all kind of physiotherapy, but his pain problem is not settling. So started investigating, we realized that it is not just his knee, it is his hip also facing a problem. His overall lower limb alignment is slightly bent inside, that is what we call varus. But this bend is compensatory to the problem what he has in the hip joint. So normally we have done plenty of surgeries like this with the deformity, we have corrected it. But in this patient, it is a compensatory deformity which is helping him to move on. So correcting this deformity completely will also give him problem. So then we tried our past experience. When the deformity is there, if you want to do knee replacement surgery, I think the robot comes into picture. So we have our robo, which is a completely automatic robo, which is a bird-based technique, and we have well trained in it, and we had crossed many number of patients we had done with these surgeries. So we thought, yes, this can be an easy thing to go with the robo. So we tried to proceed with the robotic surgeries. So similar varus bent patient who had difficulty in walking, so they were comfortably corrected by our robotic surgeries. Okay, so we have plenty of examples like this, wherein this patient, what you're seeing, is having more than 20 degree of deformity with multiple loose bodies in the knee which were removed, and then he was comfortable walking. And there is one more patient, we are already talked about this guy. He had a femoral implant in his knee, and that was also corrected without taking out the implant. So these are the advantages that we are already experienced with. So that's why we thought we'll take this challenge. And we, in this robo, many of the time we plan the surgery, we exactly know where the implant sits and how it will be sitting inside the body. So when we try to plan